cancer survivorship now owns its own place on what we look at as the cancer control trajectory. So that we often think of as starting with primary prevention, detection, treatment, and then we used to jump to end of life. And we've realized, no, the vast majority of people are going to have this very long period of living simply with a history of this and may die of something actually unrelated to their cancer. So understanding what that long trajectory is, probably the longest in most survivors' life is going to be, is that period post-treatment. Whether they have a recurrence and are retreated or not, that's a very big block of time. And so it now exists as its own area of expertise, and we have a lot more information about what are some of the kinds of problems that individuals face that patients used to come back and tell their clinicians about and be dismissed. Doctor, I'm feeling tired and it's 3 months since treatment ended. When's this going away? I can't remember a thing. When's my sex life going to revitalize? Will these pain syndromes resolve? Do I need to worry about another cancer? And if so, what kind, and what can I be doing about that? Am I at other risks for different kinds of comorbid conditions, heart disease, bone health? What's my life going to be like afterwards? What can I be doing about that? And I think we're much more sophisticated now. I think we realize those dialogues are important. Certainly the coalition with the redefinition of what it means to be a survivor from diagnosis to end of life has changed the dialogue. And we've seen that happen. So those conversations are happening now at time of diagnosis. So people are making informed decisions. And we now are beginning to have the data to say, well, how many people might be infertile and what are infertility interventions? Can we bring those forward? How many people may be at risk for fatigue? Can we mitigate that? I think we're seeing much more in the way of addressing those concerns and not dismissing them and saying, oh, we don't need to worry about that. We do. That's very much part of care today.